Edo State government has assured citizens of a better healthcare services, especially children who are to be immunized in the state. The Director Disease Control and Immunization, Edo State Primary Healthcare Development Agency, Dr. Esegbe Efeomo, stated this at the stakeholders meeting towards the big catch-up vaccination exercise in Benin City, Edo State. Dr. Efeomo advised parents and caregivers to avail their wards for free vaccination as it was safe and good for their healthy upbringing. He said they should disregard any rumor of unsafe vaccination for their wards and assured them of government's concern about the welfare of all citizens of the state, including their children's healthy living.
It's also going to support those LGs to ensure that zero-dose children or children that are under-immunized are vaccinated in those communities. So the whole 18 local governments are going to cover this period. So with your help, I'm sure we'll be able to hit and surpass our target as a state. It's a phased intensification. We're going to be having it in January from 6th to 11th, then February 2, after National has reviewed and assessed our performance in February, and then in March, and then we'll go on. But it's not the end of talking about immunization and ensuring people within our space get it. It's just that we're trying to intensify this period to close this gap and ensure that our people consistently take it.
Mrs. Irene Wagbo, Edo State primary health educator in the agency, said state government is ready to get rid of any form of child disease through immunization and ensure a drastic reduction of disease in the society. She explained that the immunization exercise is targeting children between the age of 5 months to 5 years, and the program is aimed to close the gap created by enough immunization, which reintroduced vaccine-preventable diseases in communities across the state.
It's a strategy carried out in the Edo State Primary Healthcare Development Agency in Edo State and the National Primary Healthcare Development Agency, where children of eligible age between the ages of 0 to 59 months will be vaccinated in the state. Those that have actually missed their vaccination, that's the target. Those that have missed their vaccination, routine vaccination. There's something we call the routine immunization, and it's a schedule. We have parents that they do not follow the regular schedule, they miss their vaccination for their children. So because of that, we're coming together to ensure that parents and caregivers that have children within this age bracket 0 to 5 years that have missed their vaccination. We have parents that will say, I was supposed to be there so day. I was supposed to be in the primary healthcare center maybe 2 weeks ago, but the time has passed, I will not go again. Things like that. And even from the COVID-19 era, we noticed that with our data, we noticed that there's a decline in routine immunization, in the access of routine immunization. So many parents do not access our primary health care as they used to, and Edo State is known for compliance when it comes to routine immunization. But since the time of COVID-19 pandemic and till now, we keep getting decline, we keep getting decrease in routine immunization for our children. So this big catch-up covers all of that. We're coming out. We just called for a stakeholders meeting to ensure that everybody is aware. Critical stakeholders, relevant stakeholders are aware of the program. We'll be coming up between the 6th and 11th of January. That's for the first phase. It's going to run through the first quarter of 2025. There's going to be another tranche in February and in March. So for January, we have the days between 6th and 11th of January this year, where we'll see healthcare workers, vaccinators in our communities going around to check vaccination cards of our children on our wards. Like I said, the target age is between the age of 0 to 59 months, that's 0 to less than 5 years. So by the time they go around, please, parents should avail them. Show the vaccination cards of your children to these healthcare workers, so that they will know which and which you have missed. When they see the card, they will know, they'll follow and see which you missed. If you didn't miss any, and you're good. But if you have missed 1 or 2, it will be administered to the child.
Mrs. Irene Nwagbo urged stakeholders, media, civil society, religious leaders, and social commentators to spread the awareness in the society, to educate them on the importance of the vaccination and how it would avert any form of disease in their children now and in the future. He further appealed to stakeholders to take the message to various communities across the state, especially riverine communities that cannot be easily reached, for people to be aware of the vaccination and get their children ready for immunization.
Present here we have traditional rulers, we have religious leaders, we have stakeholders from the education sector, we have stakeholders from the media, we have several stakeholders that can help us push our message forward, that can make us push our message for the public to be aware of what's going on in Edo State.
Irene Ejoba, PFM TV News.